What is a brain damaged baby case? Brain damaged baby case is essentially the term used to describe when an infant is injured during the birthing process and injured to the point where the brain is injured and the baby suffers brain damage. This can happen during the delivery process. It's not common, but it certainly can happen. It's a very serious complication. And for the most part, the diagnoses that are given typically are cerebral palsy. So that diagnosis suggests that there was brain damage and that the baby will have impairments going forward. This injury, cerebral palsy, is really under the larger umbrella of brain injuries called HIE, which is hypoxic ischemic encephalopathy. Fancy words, essentially just meaning that the baby did suffer brain damage like cerebral palsy and will have issues going forward. It's a very serious injury and something that we've handled. How does this happen? How does brain damage occur during delivery? For the most part, it happens when there is a lack of oxygen that gets to the baby's brain. And that can happen in a lot of different ways. So some examples of events that can cause a lack of oxygen to reach the baby's brain. First would be the cord is wrapped around the fetus's neck, right? So the fetus is not getting enough oxygen that way. Another way that we see in cases is something called the placental abruption, a medical term. So the placenta is actually a temporary organ that during pregnancy supplies oxygen and nutrients from the mom into the baby through the umbilical cord. It's also how waste is taken care of during this process. So it's a very vital organ, obviously. It's providing all these things to the baby. And so if something bad happens to the placenta, that can absolutely result in a lack of oxygen that is reaching the baby's brain. So that's an event that can cause the baby to lose oxygen. Also, another example would be if the mom is going through a prolonged labor. So labor is obviously different in every situation. Every mom is different, every situation is different, and the labor goes through stages and steps. And there are times where it's going too long. And that would suggest maybe that the baby is losing oxygen to the brain. And the doctor then would have to figure out, why is this? Why is this taking so long? And again, for this, there could be a lot of reasons. The baby could be too big. It could be that the baby grew too much, and given the mom's body and the measurements going on in there, that kid's never coming out through the natural birthing canal and the natural way that babies come out. The baby's just too big, so that's not going to happen. It could also be that mom is exhausted. Maybe she's been in labor for hours and hours. People could be in labor for 2 hours or for 20 hours. Maybe mom's reached a point where she just can't push anymore. And this is something that the doctor will evaluate and see, okay, this is a problem, and this could result in the baby losing oxygen. So what's supposed to happen when the doctor realizes that the baby is potentially not getting enough oxygen to its brain? What's supposed to happen when the doctor reaches that point is that the doc has a decision to make. And if it's clear, and we'll get into this a little more, if it's clear that all these factors show that the baby's in trouble and the baby's brain is not getting enough oxygen, the doctor is faced with a decision. And that decision most commonly is, do we take the mom into the operating room for a cesarean section? That's also called a C-section. It's a medical term. It's a surgery where the baby, instead of going through the natural process, is taken out by an operation. So typically, mom gets to the hospital, they go on the maternity floor, they go into a birthing room, and then there's nurses, and the other parent is there, and they're coaching mom, and she's pushing, and it's a process. And if it goes according to plan there, the baby's going to be delivered naturally, and it's going to happen in that room, right? When the oxygen to the brain becomes an issue, and the doctor decides, okay, this is a problem, let's get the baby out now, we have to take the baby for a C-section, mom gets taken from this delivery room to the operating room, and this C-section is performed. Now, the C-section is essentially an incision, a cut just beneath the mom's belly into the uterus where the baby is taken out. So there's no more stress on the baby, and the baby doesn't have to go through that trauma of getting squeezed into that birth canal and pushed out or pulled out. The baby is out, and the baby can now breathe on its own. And this is where most of the lawsuits that we've handled, this is where it occurs, where the doctor doesn't realize soon enough that there has been a loss of oxygen and a potential injury to the baby's brain. That's where the case can be what we call a delay in performing a cesarean section, meaning that the doctor should have recognized this sooner, that the doctor should have realized, given all the symptoms and given all the presentations that were before the doctor, that, hey, this is an emergency, we got to get this baby out. And perhaps the case would be that the doctor delayed getting the baby out by C-section. There are also cases where the doctor never does the C-section. There's a labor that usually is traumatic and the baby's born. Those cases would be a failure to even perform the cesarean section. So those are typically the theories that are used by lawyers, that the doctor failed to timely do the C-section or didn't do the C-section at all. Now, it's a tough decision to make, and it's a tough call to make. A lot of moms are expecting to deliver naturally, right? A lot of moms are hoping to deliver naturally, and that's the plan, right? And you want to make the patient happy, you want mom to be happy, and that's why it's tough being a doctor, because you want to do that, but at the same time, you don't want to jeopardize the mom's life, you don't want to jeopardize the child's life, you don't want to jeopardize their health. And if you suspect that the baby's not getting oxygen, obviously that's going to affect the baby's health. So this is why the doctors get paid big money. They got to decide, is it time for a C-section or not? So then the question is, how does the doctor know when it's time? There's no alarm that goes off to say, okay, bell rang, now it's time to do the C-section. This has got to be something that the doctor decides, but how? There are things, there are monitors, and there are studies and testing being done throughout the pregnancy. And that's how doctors make decisions in general. If you hurt yourself and you're in an accident and you break your arm and you go to the emergency room, they don't just look at your arm and say, oh, it's broken. They take you for an x-ray. So they do a study and they see inside and they see the bone. If you have chest pains, they don't say, oh, you're having a heart attack and there's plaque in there, we got to put in a stent. They do a test. They do an angiogram, there's a camera that goes in, and they see it. If you're confused and you don't know where you are, you're disoriented, you may be having a stroke, they do an MRI, they do a CAT scan, they see a picture of your brain, what's going on. The same thing is happening for moms who are delivering babies. What they are using to monitor what's going on inside the body of the mom is a fetal monitor device. It's called fetal monitor strips. Now, they're no longer strips. They used to be something that get printed out from a machine and the doctors and the nurses would read them. Now it's all on a screen, so it's much easier. But the fetal monitoring is what's taking place. The fetal monitoring is what the doctor is using to make this decision on, is this baby being stressed out? Is it in distress? Is it getting enough oxygen? What's going on? So the fetal monitor is measuring two things. And this is the most important piece of evidence in any brain damaged baby case that involves a failure to do a C-section or timely do it. So it's measuring two things on these fetal monitors. One is the baby's heartbeat, right? So there's a line that is just measuring the heartbeat. Like you see people in the hospital, they're attached to a machine, they see the heartbeat beep, and you see it, and you see how it is. Is it normal? Is it too fast? Is it too low? Is it abnormal? It's right there on the screen. Just below that is another line that's measuring the mom's contractions. And you can see when a mom is having a contraction. So it measures the frequency, the duration, and the intensity of the contraction. So the contraction is the term used to describe how a mom's uterus contracts during the delivery. Now, the contraction is happening so the baby is gets pushed out, right? So that's the process. She starts getting contractions because that means the body thinks it's time to get the baby out. So it contracts, so it compresses to push the baby out of the mom. So the doctor is looking at these strips and the doctor is seeing, okay, how is the heart rate for the baby and also what's going on with these contractions, because they can see both at the same time. So typically you will look at the monitor and you see when the mom's contracting and squeezing the baby to push through the birth canal, the fetal heart rate generally goes up, right? So it's common and expected for the heart rate to go up during a contraction. The contractions, as time goes on, the contractions get longer, they're more frequent, and they get longer in time as far as how long it lasts, and it increases in intensity. However, there are times when there's no contraction and there's evidence that the baby is stressed, right? So there's sometimes you can look at the fetal monitor strips and see that the heart rate is abnormally high or abnormally low, and there is no contraction. So why is that happening? And that's something the doctor has to investigate. So in these cases that we've had and that we take, there's usually abnormalities with the baby's fetal heart rate that we see on the monitor that needs to be investigated, that needs an explanation. Why is this happening? And that's the clue for the doctors and the nurses to say, hey, this is not going great. These readings of the baby's heart rate are abnormal. Now, there are reasons why that are acceptable and known and common why that would happen and normal. And then there are others that aren't, right? So these readings taken into consideration with everything are very important. And when I say that, when I say they're taken into consideration with other things, every patient is different, right? So the doctor has to know who he's dealing with. So is this the woman's first pregnancy? Is it the first time she's in labor? That's important. Does she have 3, 4, 5 babies before? That would be an important fact. Did this mom have a C-section before? She had a C-section previously and now wants to deliver naturally. Now, you think that may not be a thing because once you have one C-section, you may have to keep doing it, but it actually is a thing that you can attempt to have a natural childbirth after having a C-section. But obviously that increases your risk for having a complication during a natural delivery. Last time you had to have a C-section, there was a reason for that. And if the doctor's allowing you to try to do it naturally, okay, but we got to be careful. So all these factors come into play, especially the monitoring, when a doctor is faced with the decision, okay, what do we do? Is it time for a C-section or not? Do we wait? Do we let her go? These are the issues the doctor has to deal with. And these are usually the issues that are involved in a case involving a brain damaged baby. How does it become evident that there was potentially brain damage that was caused by some event, by some lack of oxygen most likely? One of the biggest ways to see it sooner rather than later is right after the baby is born. There's an assessment of the baby and there are scores given to reflect how healthy or not healthy the baby is out of the gate. So these are called Apgar scores, APGAR, and they're essentially a scoring system where the nurses and the doctors just really look at the baby and they give a score. The items are that they're looking at the appearance, like the color of the baby, the pulse, meaning how the heartbeat is beating, the reflexes, muscle tone, and just is the baby breathing? Sometimes the coloring could suggest that the baby's not breathing at all. Obviously, that's a problem. But so each of these categories gets a 0, 1, or 2, and there are 5 of them. So the best score is 10, and the worst score is 0. So if the baby comes out and the nurses and the doctors evaluate the baby at 1 minute after birth and 5 minutes after birth. And so they do it once, wait another 4 minutes and do it again. So if the Apgar scores after being alive for 5 minutes are 1 in 3 or something very low, like that's a 5-alarm fire. That's the biggest indication and the earliest indication to the people in the room, the doctors and the nurses, that something's wrong here. And there may have been some incident that occurred during this labor and delivery that resulted in brain damage to the baby, that the baby did not get enough oxygen and there's damage to this child's brain. You could also see sometimes right at birth, the infants are having seizures. That's huge evidence that there's a problem with the baby's brain. And essentially what happens is if this is suspected, then the baby gets taken to the NICU, the NICU, the neonatal intensive care unit, and they do certain things. So they do cooling. They put a cooling cap on the baby's head to prevent swelling. And they do all kinds of tests, right? So the baby's in the hospital. If they suspect brain damage, they start doing MRIs, they do CAT scans, and they have IVs in. And it's a very serious situation. And then the people know what they're dealing with. Sometimes this doesn't happen right away. Sometimes there are events that occur and there's some complications, but the baby appears fine. And the Apgar scores appear fine. And the baby doesn't develop symptoms until days, weeks, or months after. And that can happen too. And there are reasons why the symptoms wouldn't become obvious or evident right away. There are reasons why the symptoms might come later. And it still may be a result of something that happened during the pregnancy, and that maybe if there was a C-section, it would have been different. So every case is different. These are just the common issues that come up typically. And again, as we discussed in the beginning, the diagnosis that is generally given when this happens, when there is a lack of oxygen to the brain during the birthing process, the typical diagnosis is cerebral palsy. The overall grouping of these cases is the HIE diagnosis. It's hypoxic, ischemic, encephalopathy. But all of those suggest that there was brain damage and that the child is suffering as a result. They have delays in certain areas, and some are very severe, and it affects their talking, walking, ability to communicate, ability to eat. Now, understand too, it's not always the doctor's fault, right? These things can happen even in the best care, in the best hands, with the best doctors in the world. So there are reasons why infants can develop cerebral palsy. It could be genetic. It could be because the infant's premature, right? So if a baby's born at 32 weeks instead of 40 weeks, obviously that's a problem because the baby's not developed. The vital organs haven't fully developed, the lungs, the heart, the brain. And with science today, it's common that more and more premature babies are being delivered alive and potentially healthy, but those are high-risk pregnancies. The mom could have something genetic about her makeup, or the dad, and they pass it on to the child, and that could be the reason why the child has brain damage. It's not always the doctor's fault. Sometimes they happen for no reason at all, and sometimes there is a reason to look at and see if the treatment that the mom got during the delivery was proper and up to the standard of care. So if you're watching this video because something like this happened to you or someone you know, and you're wondering if there were mistakes made that resulted in this and it wasn't just something that happened and it wasn't something genetic, if that's something that you're considering, that you can contact us. We'll gather the records, we'll investigate the case, we'll hire the experts we use for these cases, and we'll do a thorough investigation and let you know what we think. Thanks for watching.